All right, thank you, Brittany. Colon cancer is the second leading cause of cancer death. Approximately 150,000 new cases of colon cancer are diagnosed every year in the United States, and nearly 50,000 people die from the disease. Joining us now to talk more is Dr. Vinay Rai to tell us about this, the risks that you need to know about, and what we can do in the unfortunate event that we have to deal with this. Doctor,
Sure.
thanks for being with us this morning.
Thank you.
So, why is it important to know about colorectal cancer?
You know, as you said, it is the second most common cause of cancer-related deaths in this country if you combine men and women. And most of these cases are preventable if you do the screening efforts. And even if you have cancer, if you diagnose early, more than 90% of the cases can be treated.
Really?
And they can be cured.
Okay, so early detection is key to this.
Yes.
So along those lines, what are some symptoms that people can expect from colon or colorectal cancer?
Sure. Bleeding in the stool is one of the most common symptoms if you have. There are other causes of bleeding as well, but if you are above a certain age, like 40 or 50, then you should be more concerned. Change in your bowel habits. If you start having either constipation or diarrhea or alternating diarrhea and constipation, along with some abdominal pain and distension, you should be concerned.
Okay.
If you start losing weight, which is unintentional, or you start feeling tired, then you can have colon cancer too, because it causes anemia, which is the less blood cells in the body.
Okay.
So these could be some of the symptoms which could indicate that you have this problem.
Okay, something that we need to see a doctor if that happens. Now, in terms of risk factors, who is at risk for this disease?
One of the things we say most common is the age. As we grow older, there's more chances that we can have this cancer. That's why we recommend screening starting at 50 years of age. Now there are some recommendations like from American Society of Gastroenterology that for African Americans you can start as soon as 45 because of their higher risk of getting this cancer. If you have any family member with colon cancer and it was diagnosed before they were 60 years of age, that increases your risk. If they have any advanced polyps, polyps are the growth in the colon as we know, then you are at increased risk. And there are certain genetic factors. So if you have family members or multiple family members with this kind of colon cancer or breast endometrium, which is the uterus cancer, ovarian cancer, that can increase your risk
Your
too.
risk as well, okay.
Yeah.
Now, at Sandoval Regional Medical Center, how do you diagnose and also what do you recommend to help us prevent developing this disease?
Sure. One thing I would recommend, once you touch age 50, either you are male or female, you should get a screening done. The best screening test is the colonoscopy. The advantage of doing colonoscopy is you can diagnose and remove the polyps at the same time. Polyps are mushroom-like growths which grow from the lining of the colon and the rectum, the large intestine, and if removed in time, it prevents colon cancer.
Okay, and that's what those screenings can help detect.
There are other ways of screening, and sometimes due to resources, primary care providers can check your stool by a chemical test for blood every year, or do some kind of study where they put dye in your colon. They are diagnostic, but we cannot remove polyps. So if you get diagnosed, then you need to be referred for a colonoscopy to get the polyps removed.
Okay, fantastic. Now, if we want to contact the Sandoval Regional Medical Center for more information, what is the best way to do that?
The best way is to call our centralized scheduling number. It's on our website.
Okay.
And if your primary care provider wants to contact us, they can call me directly, and we can set you up.
Okay, Dr. I appreciate your information today. Again, folks, if you want a full recap on this or links to UNM Sandoval Regional Medical Center, head over to casa.com.
Thank you so much.
Thank you.